Okay, now before we go to the risks, okay, we'll take a caller right now. Good morning. Hello, Mr. Lingam.
Good morning, Yasmin. Good morning, Angeline.
Hi, good morning.
Morning, doctor.
Good morning.
The question for our dear doctor?
Doctor, I'm 60 years old. I had my gallbladder removed 20 over years ago. I just want to get your opinion on this. And then lately, about 2.5 years ago, I had a very severe abdominal pain, you know. And they tried to diagnose, and they thought it was gastric ulcer and all that. But then later, with all the intravenous medicine they gave, the pain did not go down. So they said it might be my pancreas. So after that, they did ultrasound. They found that my pancreas was a bit swollen, and my serum amylase went into 4 figures. Normal. After a few days, it came down to 50 something.
Yeah, it's pancreas.
So they did a laparoscopy on my system orally. That means it go down to your stomach, and then they said that my stomach walls, is eroding. But I just want to ask you, doctor, with that they said I've got acute pancreatitis. But then would you be able to tell me, doctor, with that 4-figure reading on my serum amylase, and then after a few days of resting and treatment, it went down to 50. Do you think that nowadays pancreas cancer of the pancreas, it is quite rampant now? Do you think that with that reading and all that, will this lead to cancerous pancreas or whatever it is? Because I would like to know, will you give me some advice regarding how I should take care of myself regarding my pancreas? Thank you, doctor.
Thank you.
Right. So whenever you put the camera down your esophagus into your stomach, that's known as endoscopy. When you put it through your abdomen or thorax, then it's laparoscopy.
Laparoscopy.
If you put it through your joints, it's called arthroscopy.
All right.
If you put it into your brain, there's even laparoscopy for the neurosurgery as well. So pancreatitis has a lot of etiology: alcohol, smoking. These are the common ones. And as you know, hypercalcemia, hypertriglyceridemia, cholesterol.
Okay.
And there's also, we don't know the cause. There's also a certain percentage where we don't know. And pancreatitis doesn't lead to cancer. Everybody's worried about cancer. Okay. The best person to actually answer this question is a hepatobiliary surgeon.
Okay.
I mean, somebody like me who has subspecialized into a division called hepatobiliary. Okay. So what I need to tell him is he doesn't need to worry. Okay. But he needs to follow up, because once you get pancreatitis, you can get pancreatitis again. And pancreatitis can be life-threatening. You have mild, moderate, severe. And if you get severe pancreatitis, it is life-threatening. You have a mortality rate, So don't think it's a simple thing. If you have pain, you need to have your blood test done and find out the severity of it.
Okay.
So you are quite, you have a few fans today. We have another caller on the line.
Good morning. Hello.
Hello.
Morning,
Hi.
Francis.
Hi, can you hear me?
Yes, you're on the line. You're on air.
Yes, great. Very short question, doctor. Cost factor, compare conventional to this specialized surgery. Can you elaborate on that?
Okay.
Thank you very much.
All right. Thanks.
Now, that is the major factor.
Okay.
Why laparoscopic surgery never picked up? Cost. The laparoscopic set and instrument alone, just the TV screen, the HD TV, 3-chip camera system, we have the latest now. It's about $230,000. Your instruments alone will cost you about $60,000. Okay, and then you have various instruments now to help you do operations, to cut and staple, and each time you use it is about $1,500, $2,000, and it's because of these instruments that we are able to do big surgeries now. We're able to take out the kidneys. We're able to take out the spleens. We're able to do colon cancer laparoscopically, which wasn't accepted previously, but it is now. Okay. So things are slowly getting acceptance. The cost difference. Now we use something known as pots. If you saw the instruments now, we have to use pots to get the instruments in and out. So each one of these pots costs about $300 or $400, and they are disposable, single use and throw. Okay. So we use 3 or 4 of these. So cost comes there. Okay. And then whenever they use these instruments, they do an additional charge.
Right.
So what we try to do is we try to minimize it for the patient, but somehow or other, in major cities like KL or Penang, the cost goes up by about $2,000. So if your regular surgery costs 5,000, it'll be 7,000 in big cities. Whereas in small cities, it's totally different.
Okay.
Sometimes they're about $500 difference. That's it. We don't put in any cost to the thing at all. As far as surgeons' fees, no difference. Thing is, when see, all surgeons have to follow a guided thing. So whether I sit in Taiping or I sit in KL or Penang, we have to follow that.
Right.
So if I do an appendix, the guy in KL charges the same. Just because we do it laparoscopically, we cannot charge more. The reason being, the Ministry of Health guidelines was set in 2002. And in 2002, nobody did laparoscopy except for gallbladder.
Okay.
So now it's really cheap for you to get your surgery done, okay, before they realize that laparoscopy is in, because they haven't revised it since 2002.
And they might realize it after your statement. Okay, but do we have another caller on the line? No.
Hello.
Hello. Good morning.
Tom here.
Hi, Tom.
Yeah,
Sorry to make you wait.
I've got a question for the good doctor this morning. You know, what about laparoscopy? Is it something, do they do anything for the heart?
Okay.
Like angioplasty? You know, they make the incision from the groin. Now that I don't understand, why can't they just go straight for the heart?
Okay.
You know? And as for the laparoscopy, I just need to know more about the surgery or on the part of the heart.
Okay.
That's all.
Angioplasty.
Thank you.
Thanks, Tom.
Right. Okay, now even cardiothoracic has gone into minimally invasive now. And in those days, whenever you do a bypass,
Okay.
they make a big incision down your leg to take the vein out, and you have a huge, ugly scar.
Yes.
Right.
So when my mom had her bypass, I got my friend to do it, and she just has one scar here and one scar here, and the vein was harvested laparoscopically. So, you know, when you compare it, she doesn't have the itchiness, she doesn't have the scar, she doesn't have the pain. She just has two little incisions here for removal of the vein, when you should have a long one across the leg. So things are going there.
Okay.
It is being done overseas, and I do believe IGN has started. I'm not an authority to speak on this.
Yes, yes.
Okay, but I am aware of people coming down and doing cases with the guys in IGN.
Okay. Now, doctor, very, very briefly, now I'm sure there are certain risks as well, and let's close this topic as well with the risks before, and advise, okay, people out there before they actually agree.
Yes, and what should they look for in a surgeon if they're interested in laparoscopy? What is the certificate training or the
criteria.
years, the criteria that they should look for in a surgeon?
Currently, according to the Ministry of Health guidelines, any qualified surgeon is doing laparoscopy. There are
Only-
about 380 surgeons, and everybody is doing. See, laparoscopy is divided into basic and advanced.
Okay.
Okay, basic is considered as appendix and gallbladder. Everybody does basic. But even then, even basic
It's the
can
skills.
get messed up.
Okay.
Okay, and we have
That's scary.
yeah, right. So what we're trying to do is we're trying to actually start a society. We have societies everywhere now. Okay, overseas. We're trying to start one in Malaysia. We submitted to the Society of Registrars. It's called SOMAS, and hopefully when the society comes up, guidelines come up. There are no guidelines now. There is no credentialing committee as to which surgeon can do and which surgeon cannot do. You can actually go over to Taiwan or Vietnam and just look at a guy operate for a week and come back and start doing on your own, and nobody's going to say anything. Okay, so we hope that, you know, after the society starts, credentialing process starts, Ministry of Health pays attention to this,
Okay.
Okay, so
they start controlling.
So right now they've got to go.
Right now it's
to-
free for all.
Right now, a credible hospital. That's all.
Okay, so let's see the polling result for today. I'm still a bit struck by the fact of the reality of that. It's free for all. Okay.
Okay, and thank you very much, doctor, for enlightening us on laparoscopy.
Go type laparoscopy. Go type and
Right.
take the knowledge. It's really great, but
Right. And the reason why, we are a bit kanchiong, okay, because we see Mia Palencia getting ready to sing one more time for you, and her voice just gives us goosebumps. So we hope that it will give you goosebumps as well. Thank you for joining us this morning.
yes.
Goodbye for now.
Bye.